Welcome to Forward Ever, Leading in Challenging Times, presented by Worth Wealth Management, a weekly conversation with area leaders about how to persevere during uncertain times. Now here's your host, Gary Shorman.
Welcome to Forward Ever, Leading in Challenging Times. Our program is brought to you by Worth Wealth Management, and we're going to be talking about, it may not be the most important program ever, but it could be, if you're a man, the most important ever. Because this week we heard about former President Joe Biden being diagnosed with prostate cancer. So our guest today is Dr. Will Parker with the University of Kansas Health Systems. I know Doctor personally because I've been through the prostate cancer treatment process. And Dr. Parker and his team do an excellent job. They're an excellent resource for being able to do this. And if you look down and you read about Dr. Parker, you'll find out that he not only is great at what he does, over 1,000 robotic surgeries. He writes nationally. He's recognized nationally, but he's a real promoter of getting tested early. And I thought it'd be a great time to bring Dr. Will Parker on board here to talk about prostate cancer. We're hearing a lot about it in the news. And so, Will, welcome to our program today.
Thanks for having me.
You know what? You don't want to get into the prostate cancer discussion personally. I did because I'm one of the 8 men who, didn't have any symptoms, or at least I didn't have any symptoms. Next thing you know, you have a rising PSA number, and I get to meet you, and you get to tell me I have prostate cancer. That in 1 in 8 number is a surprisingly high percentage of people. This week, Joe Biden announced that he has had prostate cancer. Talk a little bit about what prostate cancer is.
Absolutely. So first off, I think it's important to recognize what is the prostate. So the prostate is an organ that men have. It's a reproductive organ. So it's involved in generation of the fluid that supports sperm so that we can reproduce. And so obviously it has a very important role early in life. But then as we age, things start to happen to the prostate. It can grow and cause symptoms, or it can degenerate and become prostate cancer. Prostate cancer is a cancer of the gland, the prostate being a gland, that is what I consider as a spectrum cancer. I mean, it's not just yes or no. You don't just have prostate cancer. It's graded on a scale. And as we learned in the news, if you've been following this, when the former president was diagnosed, he announced that he had had a grade 5 prostate cancer. And we grade prostate cancer on a scale from 1 to 5. So he had a prostate cancer on the highest end of the scale.
When you do that and you do the grading, how do you go about getting to that grade?
So it all begins with a prostate biopsy. So once we've established that somebody's at risk for prostate cancer, in order to make the diagnosis, we have to get some tissue. And so that's using a small needle to take samples from the prostate, most often done through the rectum, unfortunately. But then we get that tissue and a pathologist can look at it, and they use some criteria to judge how aggressively it looks under the microscope.
And when you get that back, then you start looking at different solutions for that. Let's go back one step further. Prostate cancer is diagnosed in what way? Sometimes there's, I'll call it a digital test, but what are the ways that the prostate cancer is diagnosed that leads up to the biopsy?
Absolutely. So most of the time it begins with a blood test. So PSA, or prostate-specific antigen, is a readily available blood test. It's a screening tool. It is a continuous number, and essentially if your number is high enough, we would say you are at risk for having prostate cancer. That's often then paired with a digital exam, so a finger exam to feel the prostate to see if there are any lumps or bumps, nodules that lead us to have a further suspicion that you would have prostate cancer. And then that's what gets us to the point of saying, you need more testing. And while that may be a biopsy, it could also be some imaging. We use a lot of MRIs today to look at the prostate before we ever stick a needle into the prostate to ensure we know where to look, and we know that we are actually looking in somebody who needs to be addressed.
Now, many men out there, and you've been helpful with my organization, alive2ride.org, which is really out there not to solve the question of how do you cure prostate cancer. It's out there to help men or encourage men to just go get this test done. What do you see happening, and what maybe are the blocks for men getting tested?
There are a couple of different things that contribute to these roadblocks, if you will. So one is we as men are not great at getting healthcare. And so the first thing I would say is just routine access to preventative healthcare, seeing a primary care physician, doing the things that need to be done to keep yourself healthy. There's another part of the problem. So PSA testing is somewhat controversial in the community. And so while as a urologist and someone who treats prostate cancer, I believe that PSA testing should be done regularly. I know it improves outcomes. It allows for early detection and treatment. Not everybody and not every medical care professional feels the same way. And so the other piece of this is self-advocacy. Recognizing that as a man, you have a risk for prostate cancer, you should be asking, am I being screened for prostate cancer? Am I getting that test done? That doesn't often happen.
Well, the surprising part of that, it's a simple add-on to a blood test. So if you're going to a doctor anyway, ask for that extra blood test. I think it's a $15 or $20 add-on. It's not a big add-on for doing that. But I do run into men who, one, they have never been to the doctor. I had a note the other day from a friend, and because I'm involved with this Alive to Right process, who says that you encourage me to just go to the doctor to be healthy, and my screen came back okay. Everything was fine, but I wanted to thank you for doing that. That's probably the first step, is you want to be healthy. But if you don't, and you don't get that test, and you don't find out, you may have no symptoms, but there are other symptoms. What are the other symptoms that people could see?
So specifically with prostate cancer, what we see as symptoms are going to be some obstructive urinary symptoms, so slowing of the urinary stream, difficulty emptying, maybe some blood in the urine, pain with urinating. Those are the local symptoms that we see. And now I just want to take a second to point out, those are very common symptoms for the most common problem the prostate develops, which is just benign growth. So as we age as men, prostate can become bigger, and those symptoms can develop. And I don't want people hearing this to think, if I'm having those symptoms, that means I have prostate cancer. It does mean you need to be evaluated, but it's not a necessity that you do have prostate cancer if you have those symptoms. Other things that can develop if the cancer then further progresses are pain and symptoms, typically in bones, because one of the most common places prostate cancer can spread is to the bone. And
I
as we
know
learned, obviously, that's what the former president had, was prostate cancer that had spread.
Yeah, and that's the kind of the next question here. When he released that information, what were your first thoughts on that?
Well, obviously, first, I feel very, I feel for him and his family. I mean, this is a terrible diagnosis to have. It's any cancer, I think, is very, it's a humbling moment, and it's a hard thing to have to deal with. And so I feel for them. I think the second thought is here is a man, the former president of the United States, who is getting excellent health care, or assuming, I don't have access to his health records, but I'm assuming he's getting excellent health care. He's heavily resourced. And prostate cancer being the great equalizer, he gets diagnosed with prostate cancer, right? This can affect anybody, anywhere, at any time. And so I think it just goes to the point about how important it is to be looking and be diligent about healthcare.
I think that's an excellent point, because you run into people that are very, and I don't know where former President Biden fits it on this, but he had access to health care. A lot of people may not have that much access, but a lot of people are physically healthy. They're runners. They do all sort of athletic stuff. They feel good. They feel healthy. But that 1 in 8 really doesn't just say, hey, just because you're feeling healthy, just because you're feeling good, just because you're riding a motorcycle, in my case, across the country, and have no symptoms, it doesn't avoid that. So there's really not a health related thing as much as it is just a diagnostic type of thing.
Correct. This is 1 in 8 men in general, right? It's not the 1 in 8 who are unhealthy. This isn't what we consider an exposure cancer. So it's not something where, you smoked and then therefore you got prostate cancer. It's not I ate unhealthy foods and therefore I got prostate cancer. It just happens. And the unfortunate reality is that while the former president was having urinary symptoms, at least in the information that was given to the public, 95% of men who are diagnosed have no symptoms whatsoever. And so if you're thinking, well, I'm going to wait until I have a symptom to tell me I have a problem, you're going to wait too long. And that's why it's so vitally important to test early and test regularly.
Is that one of the things you see of people just waiting too long?
I do see that. I see waiting too long, some kind of a head in the sand approach. I also, in men, and this goes back to your point about encouraging men to get primary care physicians and regular health care. I see a lot of men who don't start their healthcare journey until they retire. So the working men, they say, well, I'm fine, I'm working, I'm busy, I'm active. And then they retire and they say, okay, well, now I'm going to go get a primary care physician. And that's the first time they get that PSA done. And it can be too late by that point.
When should you get tested? And
So
when does that stop? Because I've seen numbers all over the place that you shouldn't start testing until you're in your 60s, and you shouldn't test after you're 75. What are you recommending coming out of your office and from what you've seen?
So this is probably one of the biggest areas of controversy there is, the when. So the general primary care literature says you should start at 55. That's too late. So we know, and the American Urological Association, which establishes good guidelines for prostate cancer screening, says if you are an average risk man, so no family history of cancers, just kind of average guy, 45 is when you should start. If you have a family history of prostate cancer, breast cancer, ovarian cancer, pancreatic cancer, colon cancer, or if you're a Black man, you should start testing at 40. So that's when I recommend starting. Now, the stop is a much more challenging thing. So we know that prostate cancer has a long lead time in most instances, meaning that from the time we make a diagnosis until there's a risk of mortality, of dying of prostate cancer, for most men, that's a very long stretch. And so a lot of guidelines say stop at 70, stop at 75. And that's based on this idea that the average health man at that age has about 10 years of life expectancy left. And so we say, okay, if you're going to live less than 10 years, we should stop. Personally, my belief is you should continue testing until we're pretty confident that your other health concerns are going to be the priority, right? As we age, we accumulate health problems, and eventually we are mortal people. We are all going to die. And so until that point comes where I can say, you are developing enough health challenges that it would never benefit you to treat you, until that comes, you should get your PSA tested.
In going through the process with you, one of the things I've learned is you have to work on your own behalf to talk to the doctors, whether it be to get testing done or whether it be to look at the different treatment options that are out there. Does that start with your primary doctor? Or does that start when we get to your office?
I think it can start any place. It can start with the primary care physician. It can start with your urologist if we're talking about prostate cancer specifically. It can start on your own, just doing self-research ahead of time to arm yourself with some background knowledge, some kind of language, if you will, about how to communicate about this diagnosis.
Doc, let's take a break. We're going to come back, and I want to talk about some of the new things that are coming up in prostate cancer and maybe cancer in general. But there's always new things coming out, and that's the good part of this. If you can catch it early, treatments are going to be changing going forward, but the sooner you catch it, the better off you are. Doc, we hang on for just a second, and we'll wrap up the show and talk about some of those new things out there and encourage people once again to get their PSA checked. Hang on. Our guest today is Dr. Will Parker, who is with the University of Kansas Health Systems. He deals with prostate cancer every day and is a nationally known speaker and writer on that. We'll be back with more after this.
Since 1776, the United States of America continues to stand tall. It's been tested before, many times. Through grit and the ability to move forward, we create better tomorrows. We help our clients live their best lives to and through retirement. We make it easier. Thank you, Kansas. Worth Wealth Management, enhancing lives and strengthening families.
Welcome back to Forward Ever, Leading in Challenging Times. Our guest today is Dr. Will Parker with the University of Kansas Medical Systems. He's a urologist who deals with prostate cancer, nationally known. All the things you want in a prostate cancer doctor that's taking care of you. He took care of me, and we're now talking about the news of President Joe Biden, former president, who was diagnosed. There's a lot of things on the news talking about it. Doc, when you've seen these newscasts that are out there, are they really addressing the main concern in those, or is it more just we just have to have more discussion about that? Because in general, men don't like to talk about it.
Correct. Men definitely don't like talking about this. And, I think a lot about how breast cancer is communicated in, women's health. It's very readily talked about. Women are open about it. Men are not quite as good about talking about this. And I think that's a real tragedy. If we had more open dialogue, I think testing would be more readily available. People would get tested. People would talk about it. The experience would be better. It'd be less of a alone type cancer, because I do think a lot of men early in the process kind of feel alone.
One of the things that is happening today, and it's some of the new treatments that are coming out that are going to not only extend life, but also make the quality of life better along that line. How do you describe that, and how do you talk to people about that?
Yeah, I mean, this is a really exciting time in cancer in generally, and in prostate cancer specifically. There are a number of new therapeutics that are constantly coming out. In most cancers, the way things begin is we start testing new therapies at the end of the line, so late stage disease. And then once we prove that it works, we start moving it forward. And what that really helps in prostate cancer and towards the point of the former president's diagnosis, there are a number of treatments that we have for newly diagnosed men who have metastatic disease that we never previously had, that are life extending, quality of life extending. So men are not only living longer, but they're living better lives longer with this disease.
So that said, let's go back to the testing part. We're going to end up the program talking about why you should get tested and what do you want men to know, and maybe wives too, because a lot of times I've had more than one person come up to me and say, a lady say, Gary, would you talk to my husband about this? Because he just doesn't want to be tested. He doesn't want to know about it. What do you tell those people?
Well, first off, be an advocate for your health. Get tested. Ask if you're being tested. And I don't just mean be an advocate for your health about prostate cancer. I think be an advocate for your health in general. It would be absolutely a tragedy if I didn't say, as men in the United States, you're much more likely to die of heart disease than prostate cancer. And so while we're talking about prostate cancer and getting PSA testing and being screened, general health is incredibly important. That's where the needle gets moved in terms of healthier lifestyles, living longer, living better lives. So the biggest thing I would say is ask if you're being tested, ask if there are things that you can do for your health, and then do those things.
People are listening to this saying, how do I get into the University of Kansas system? How do they get to your office if they have a question about this? Obviously, you're very well. You can, I know this from fact, you talk to people and the knowledge base you have is very important. But how do they take that next step to get to a urologist to get treated?
Absolutely. So certainly, if we're talking about undiagnosed and being screened, it starts. You could ask your primary care physician to get tested. You can, go online to the KU website, and there are numbers you can call to get an appointment. So that's a place to begin there. If you already have been screened, you have a PSA and you're concerned, or the test is high and you need to see somebody, where I would start is actually call. We have KU has a nurse navigation program, which is essentially nurses that are at the ready to take your phone call, gather your records, make sure they get to the right people. So make sure they get to me or whoever's seeing you, so that when you come, you're ready. We're ready. We have all the information we need to help guide you in this process.
And is the process something that happens tomorrow? Like if you get a high PSA number, is that something that you have to do tomorrow, next week? How quick do you have to jump onto this thing?
That's a great question. So certainly, anytime we're talking about a cancer, time starts to come into the equation, right? How quickly do we need to move? Prostate cancer, thankfully, is a relatively slow cancer in the grand scheme of things. And so we generally feel, and this is borne out in the data, that 6 months is an adequate lead time, meaning from the time you say, I think I have a problem, to the time we've said, okay, here's the plan, we have about a good 6-month window. And so this isn't, as I tell a lot of men, this isn't a light your hair on fire problem. This is a problem where we actually have time to be thoughtful, have discussions, make sure we're making an appropriate plan that balances not only the goals, right, treat a cancer, but also your quality of life. What is it that you want out of this?
Last question. What do you tell people who say, well, you have a good cancer?
I say there is no good cancer is what I would say to that thing. So, I unfortunately have to give a lot of bad news because I diagnose a lot of men with prostate cancer. And I think the important things when it comes to facing a diagnosis is, what is the plan? Having a plan is incredibly important. So what I tell those men are, we need to come up with a treatment decision or maybe a management plan for whatever this diagnosis is, and just be very transparent about what that's going to be, what that journey looks like.
And if we take a cue from what happened with the former president, getting treated early is so important. So I appreciate you jumping in and talking about this because you don't have to feel bad to have prostate cancer. You don't have to hurt somewhere to have prostate cancer. It can be or cannot. But if you get tested early, I believe you would tell me that it's important to get it tested early and find out early. Sooner is better.
Sooner is absolutely better. Here are the important numbers. 1 in 8 men are diagnosed. 1 in 42 men die of prostate cancer. That's about 30,000 men a year. The vast majority of the men who die of prostate cancer are not men who are diagnosed through screening. So if you're tested and we diagnose early and treat early, it is very unlikely that men die of prostate cancer. It's the men who have delayed diagnoses that suffer the most. And so this is where being an advocate, getting tested, incredibly important.
Boy, what a great way to end this show. Doc, thanks for taking time out of your schedule to jump onto this call because it is, it's challenging when you get this diagnosis, but there's answers. Go find answers through your local doctor, work your way up wherever you want to go, but just get diagnosed sooner rather than later and get your PSA checked. That's a simple way to at least start. And you mentioned 40 years old. If you have some sort of relative that's there, go down to your doc, make sure it's being tested. And I know you'll take good care of thousands of more patients. So appreciate all the work you do every day, Doc.
Thanks. Thanks for having me.
Our guest today on Forward Ever is Dr. William Parker, who is with the University of Kansas Healthcare System, takes care of prostate cancer and speaks about it all over the country and has many papers written about that same thing. A perfect guest to follow up with the news about former President Joe Biden and what he has done and what he is diagnosed with this week. Again, thanks for joining us on Forward Ever, brought to you by Worth Wealth Management. Thanks for listening. I'm Gary Shorman.
Thanks for joining us for Forward Ever, Leading in Challenging Times, presented by Worth Wealth Management. Join us right here next week for another episode with host Gary Shorman. Until then, remember to move forward ever, backward never.